Hey guys, welcome to the SahaVida Institute. We're celebrating August National Wellness Month, and we're very happy we just opened our doors just in time for the National Wellness Month. We are here talking today about sleep and hydration and why the fuss with our wonderful Dr. Arun Rao. Before we start, I want to tell you something. We were very surprised yesterday when House of Health came to us with an offer just for you. If you guys are sharing this post, you're liking it, you will be entered to a raffle to win one of their travel kits for their skin care. So why do we talk about skincare? Because it's Wellness Month and there's a lot of things that we do for our skin that really are not the most healthy. And we have partnered with House of Health because they do natural plant-based products. And they don't use any animal products. They have just a simple 3-step plan for your skin. It's first cleansing, then exfoliating, and then hydrating. And then for this month, they have given us the gift that if you purchase one of those kits from our office, then they will give you 50% off on your eye cream. And if you share this post, then you will get access to that raffle that they have offered us. So we're very happy to be partnering with them. I don't want to lose a lot of time right now. We want just to have Dr. Rao here, so we're very happy to have her, one of our partners. And here she is, Dr. Rao.
Hi, my name is Dr. Rao, and I have been in practice for about 15 years now. And I do a lot of discussions with patients that I see on a day-to-day about sleep and about hydration. And you know, it might be an interesting combination. The interesting thing about both sleep and hydration is that they actually improve a lot of the same things. And so we always want to kind of take these supplements and do these certain behaviors, and some of the most basic things can lead to some of the biggest benefits in our life. And so one of the things that we're going to start talking about actually is dehydration. And you know, really our goal for men and women are a little bit different. So with women, at least 11 cups of water preferably, but of course fluids in general, as long as it's a little bit lower on the caffeine, and 18 to 19 cups for men. Now that's a generalization. We all come in different sizes, and it's very important to kind of drink according to our size. So what does hydration exactly do? Well, 83% of your cells is made up of water. Additionally, 73% is muscle, and 23% is going to be bone. And so there's a lot of water in your body, and it's important that we continue to supply that fundamental base to your body in a way that makes it work the best it can. So what does hydration do for us? Well, quite honestly, it actually improves your mood. It improves concentration. It actually allows for appropriate digestion. And in fact, it actually helps to prevent bad breath. It actually eliminates the bad toxins in our mouth and allows for things to be digested well. In fact, one of the most common reasons we see constipation is dehydration. It's the first thing I ask patients to try to get on top of and to solve. One of the other things that we see a lot with dehydration is it affects the immune system. It affects the normal functions of your body. It may affect mood. It may affect your ability to be responsive to the things in your environment. So dehydration is imperative. And quite frankly, it also helps even with bone and joint health. It's imperative when it comes to bone and the lubrication in our joints that we're making sure we give the body what it needs to function optimally. So why do I pair dehydration and sleep together? Because actually they're very, very similar. When it comes to sleep, it's imperative that we are sleeping not just for that minimum of 7 hours, but that it is good quality sleep and that your body is getting the oxygen that it needs. And we're also wanting to make sure that we're not seeing awake cycles and then sleeping again, and awake cycles and sleeping again. It's so important that you're getting good sleep, long sleep, consistent sleep. So what exactly does sleep do for us? Well, it really does reset the body. So what's the first thing you do when you get sick? The first thing you do when you get sick is you go take a nap. It's what your body is asking you for, because that is your reset button. It allows your body to heal. So if you're not getting enough of your sleep, what's happening is you're allowing your body to actually be more prone to illness and preventing it from healing in a way that is optimal. Additionally, when we don't sleep, we also over time decrease the length of our lives, our cognitive abilities. We see an increase in dementia and overall cognitive function. So there are very, very important things that are achieved during those sleep cycles. And so it's important that we are finding ways to develop healthy sleep habits. So when it comes to sleep, everything matters, not just when you fall asleep, but actually when you wake up in the morning, how you wake up in the morning, what type of light you're exposed to. And there's an actual temperature shift when you fall asleep and when you wake up. And so to optimize those things allows us to actually improve the quality of our sleep. It's also when we eat and when we drink in the day and right before bed. It's when we work out and to what extent we work out. And so it's important that we aren't just thinking, oh, I've got to take the melatonin or I've got to take, my sleeping aid. There is so much that we don't tap into that is our natural body's way of doing what it does best that we don't ever consider. And so one of the things I really want you to think about today, one of the goals for you today is to make a move on both of those things. I think a lot of times we're like, I'm going to go work out every day, or I'm going to eat healthier every day. Well, I want you to try and kind of chop that up a little bit, because a lot of times it's very difficult to climb the mountain. It's easier to climb the molehill. So create these little molehills. And I think that you're going to see much better improvement in those areas of your life. I think the consistency is something that you build upon. And the only way to really do that is to make it something that is feasible. So instead of saying, I'm going to sleep 7 hours every single day, give yourself the goal of sleeping 7 hours, 3 days out of the week, and then slowly ramp up to where. A little earthquake here in Florida, no worries. And then slowly what you want to do is...
I went to sleep.
Yeah, my camera person fell asleep. I did such a good job
I
on
went
the
to the
sleep.
7 hours of restarting that
She
right
started
now.
working, yeah, you started working on the 7 hours right away. But in fact, making this something that's feasible and easier to do, an attainable goal, as opposed to like creating such big goals that they may seem even daunting. It's going to be something that you gradually walk into. And one of the groups of patients that I see frequently that really just make it so difficult, not just for themselves, but their overall quality of life, are the people that work late at night. The night shift workers have some of the biggest hurdles to face because they're surrounded by, a lot of noise and distraction when they finally get home and they're ready to kind of go to sleep. A lot of times they're only getting 4 to 5 hours of sleep. Dehydration is also an issue. And when you're switching out of that nighttime shift and you're considering a daytime job, you can't just turn it on and off. So it's a gradual progression to sleeping at the hours that are more feasible and what your body really needs to get what it has to have in order to recharge and rebuild and be at its peak performance. Those were just a few of the things I wanted to touch upon today. There is so much to these topics, and I'm going to hope to share these with you as we continue to bring you SahaVida, your best healthy life. Thank you for joining us today. We look forward to seeing you and hopefully meeting you in person.
We have some questions.
Oh, there may be some questions. Any questions?
Yes. Do you have any questions about sleep or hydration? No. Well, I have a couple of questions.
Sure.
So one of the things is that they say that during sleep, right, we know as physicians that our brain basically is not only the reset, it's really like cleansing, right?
Yes.
So the toxins are eliminated during that period of time. Can you tell a little bit more about that?
Yes, actually, there is an overall cleansing that occurs while we sleep. And that's why it's important to get that consistent sleep, because you not only get that full sleep, you get REM, and you get different stages of sleep, and each of those stages has a purpose. So that's why it's important to not just get that 7 hours, but that it's consistent and that it is good sleep. That's why, like, if you find that you're snoring, if you're maybe taking the roof off the house, if you have a partner who can't even sleep in the same bed with you, a lot of people are like, I can't wear that mask, I can't. Understand that if this is the time that your brain actually cleans and restores and regenerates, that you are missing that. And that's when we start to see increasing cognitive decline, dementia, loss of focus, and an overall feeling of fogginess. Is because you aren't giving your body what it needs to be able to cleanse from the day that you just had. And I don't know about you, but life doesn't ever get less stressful, I just see more and more. So if I'm not recharging and I'm not resetting, then I'm going to continue to struggle with that.
I do have a question.
Yes.
So is there any connection between hydration and the quality of sleep? Like, do you sleep better if you're better hydrated overall?
That's a really good question. So the question is, do you actually improve sleep with hydration? And you know, those two things go hand in hand. Hydration is one of those things that optimizes all of your bodily functions from the top on down. Believe it or not, headaches can be worsened when you're dehydrated because it actually causes a shrinkage of the brain, and that's what can cause that ridiculous headache that just won't go away. So that like I said, top down, hydrating allows for better cardiac function, better digestive function. Your skin appears better. Your ability to reset those cycles is going to be better. And it basically all works in unison. And so when you optimize your hydration, it is just a piece of what is going on when you're able to get to sleep and stay asleep.
And I have one last question because I see you wearing something on your hand. And what is this type of device that we use for measuring sleep?
So this is a very unique device. It's called the Circle, C-I-R-C-U-L. And this device is one of a kind. It basically measures heart rate. It measures blood pressure. Blood glucose levels is right around the corner. And it also measures O2 saturations, and it gives you a much more complete, I know we have different products out there right now. This is one of the most complete, if not the most complete assessment of what is going on the day-to-day. And actually, you can actually get an EKG, a 1-lead EKG reading from this device and determine how many times you want to get that checked so that you can identify if there are things that are getting in the way of you living your best life.
Quality of sleep too.
Quality of absolutely. If you notice, just an example, if you're wearing this and you notice that at night those O2 sats are dipping, you should at the very least, you need to be at 92% the entire day. If you notice you're seeing dips and those are happening at night, it could be a sign that you need to go check to make sure you don't have sleep apnea. And I want to also express to you, a lot of people are like, I don't want to look like Darth Vader when I'm sleeping. Like, I don't want to look like, that big thing on my face. The thing is technologies are starting to grow, especially as it relates to sleep, because we're realizing, without good sleep, you're actually shortening your life. So we really need to kind of provide people with options that are feasible. And so it's not just the mask anymore. There are other things we can do to help you to stop snoring and to get the 100% oxygen that you really need to get to be able to reset and be able to live a better life without that fog, without the exhaustion throughout the day, without having to get a bunch of caffeine in your system just to get out the door. And so we want you to seek those answers. We are here to help you with those answers and help you with those options. And these devices are incredible because we've never had this kind of technology in the past ever. And now here we are, we're able to look and see, oh, you know what, I felt like flutters in my chest the other day and I don't know what was happening. And all of a sudden the cardiologist does an EKG and says, you know what, we don't see anything. But you're like, no, I really felt it. Well, you have a way of figuring out exactly what happened, and we can get a better look at your health when you're experiencing things instead of waiting to get a snapshot when you're not feeling that way. So super excited about this technology. That's what SahaVida is all about. We want to bring the best and the brightest to you so that you aren't second guessing what you're feeling and you're getting the most accurate assessments and treatments possible.
Thank you.
Thank you so much for having me. Thank you, everyone.